it's Martha here at Infinite Strength Conference, and I have a very special guest right across the table from me. And would you like to introduce yourself?
Hi everyone, I'm Dr. Lustberg. I'm Chief of Breast Oncology at Yale Cancer Center, and also have been working with Martha quite a bit over the years, so really nice to chat with you.
Yeah. So can you talk to us about the key takeaways from this conference for patients that weren't here?
Yeah, so I think there are several individuals commented on the sense of community that these conferences can help foster, and I think that was very clear to me, that patients and clinicians interacting together in one space. Just those interactions themselves can carry a lot of insights, and really important in terms of kind of decreasing sometimes that sense of isolation that patients can feel as they go through their treatments and are trying to figure out how to best navigate our complex healthcare system. So I think one takeaway was that kind of coming together in these type of venues can help us find those connections and help patients and caregivers and partners kind of have new tools in terms of how to find the best answers for them. So that was one takeaway. Second was that really that a recurrent emphasis was that you as a patient are in charge, and that really to advocate for yourself, really speak up for your needs, and not be afraid to essentially partner with your clinical teams to let them know the kind of things that are important to you. And I know just from interacting with patients over the years, that can sometimes feel daunting, but it's something that with the right team is something that we absolutely welcome. And then we wrapped up the conference with a discussion from Lily Shocking, with the overarching theme being "Don't postpone joy," and I think that applies to all of us, which is that really taking those moments where there's so many special moments in life, and really taking the moment to take them in, and not always constantly be postponing for some future event, and really living day to day and enjoying those joyous moments.
Do you take that advice yourself?
I was letting it sink in. I would say that I'm like most people, and that I am sometimes often running from deadline to deadline, but I think that type of advice is good for all of us. But life is short, and if you're constantly running to the next thing, what are you doing it for? So yes, I think that is a key takeaway for me as I leave the conference today. I'm going to go pick up my son right after this, and taking him a little sweet treat, and really kind of focusing on the moment that my son is young enough now that I can go pick him up, and that it's going to be a special moment that I will appreciate.
Oh, I'm glad to hear that. Can you just very briefly tell us about what you and Dr. Dizan have planned in terms of sexual health?
Yeah, Dr. Dizan and I are working on a couple of different things together. I'm the immediate past president of a global organization known as the Multinational Association of Supportive Care in Cancer. And this is an organization that focuses on improving supportive care and symptom management for all patients with all stages of cancer throughout the globe. And one unmet need, as we heard about today, is in sexual health. And so in our next meeting, which will take place in Seattle in June 2025, in the last week of June, there will be a sexual health training workshop that will be conducted by Dr. Dizan and several of his colleagues who have special expertise in sexual health. And the idea is, let's train additional clinicians to be able to support patients with sexual concerns, and to really make resources more available for patients and their partners. So that's one area. And then the second is we are launching a multi-site national study looking at a laser device. It's an intervention that has not been fully tested in a randomized fashion. So we need more data about its efficacy and safety, but we'll be looking at breast cancer survivors of all stages who are experiencing vaginal dryness and symptoms related to that. And this study that is currently funded by the National Institutes of Health and Alliance Clinical Trials will look at a laser intervention versus a control intervention to see if the laser can improve collagen production and the health of the tissue in the vaginal area. So we hope that trial will hopefully launch in the next 6 months and will be available in multiple sites throughout the U.S.
Okay, all right, thank you. I was just going to ask that. You know how you want to know where all these trials are happening.
Yes, and the name of the trial is Revitalize.
Okay.
And our hope is that that it will still be able to launch as planned. We haven't heard otherwise in the new climate of things, but we're keeping our fingers crossed that things can proceed.
Okay, we'll definitely be watching for that.
Yes.
So you know that everybody wants to know how to deal with this side effect.
Yes.
Well, thank you so much for stopping in here, and really an amazing conference that the Infinite Strength did this year.
Thank you, Martha, for all that you do. Thank you.
Yeah, thank you. All right, bye.
Bye.
Thanks.